A new report from the CDC estimates 1 in 7 American adults now has diabetes.
And nearly a third of those people don't know it.
See, this was not always the case. The prevalence of diabetes has been rising for decades.
Data from George Washington University shows that in 1958, an estimated 1.5 million people in the USA were diagnosed with diabetes. By 2010, this number had risen to 18.8 million. In 2021, 29.4 million people in the US were diagnosed. The NIH estimates another 8.7 million may currently have been undiagnosed.
At the center of the rising number of diabetes cases is diet and exercise. See, the obesity rate in 1999 and 2000 was reported at about 30%. Data from March of 2020 reflected an obesity rate of nearly 42%.
Being overweight or obese is a leading risk factor for developing diabetes, as is being physically active less than 3 times a week. And then there are genetic factors like having a parent or a sibling with type 2 diabetes, or a mother who had gestational diabetes during pregnancy. Think of your risk of diabetes like this bike on a path. If you have a genetic risk factor for diabetes, you already are at risk, but you can slow down and prevent yourself from becoming diabetic with diet or exercise. Now, this also works the opposite way. Even if you don't have a genetic risk factor, poor diet and exercise can put you on a path to become diabetic.
There are 2 common types of diabetes, aptly named type 1 and type 2 diabetes, with type 2 diabetes being the most common by far, accounting for about 90 to 95% of all diabetes cases. Both types of diabetes are caused by the body's inability to make a sufficient amount of insulin.
Think of this like a lock and a set of keys. Blood sugar or blood glucose needs to get into your cells to provide energy. It's insulin's job to act as the key that unlocks your cells so that the blood glucose can provide you energy.
Now, in the case of type 1 diabetes, the pancreas produces very little or no insulin, or in this case, keys.
Now, someone with type 2 diabetes does not have enough insulin, in this case, the keys, or they are insulin resistant, meaning they need to use far more keys, or insulin in this case, for something to actually unlock and work correctly.
You could be one of the more than 7 million Americans who has diabetes and doesn't even know it. Those millions of people without a proper diagnosis could be at serious risk of health problems.
The number of undiagnosed diabetics is so high in part because the symptoms are not obvious. Someone can be living with prediabetes and can overall feel generally fine.
This is why preventive care visits are so important, because the only way to diagnose diabetes is through a blood test. And that's why going to a preventive care visit, even if you feel relatively healthy, is still a great opportunity to check for some of these hidden risk factors like blood sugar that could be affecting your health and you don't even know it.
If diabetes is poorly managed or undiagnosed, having high blood sugar and insulin levels can cause serious health complications. Excess blood sugar is damaging to organs like eyes and kidneys, and too much insulin can damage blood vessels and increase your risk of having cholesterol deposits on the wall of your arteries that develop into blockages. These blockages can lead to heart attack, stroke, or other vascular diseases. According to Johns Hopkins Medicine, the risk of having a cardiovascular disease is 2 to 4 times higher among those who have diabetes.
Poor blood flow also makes it more difficult for the body to heal. And this can also contribute to nerve damage, diabetic nerve damage, that can occur in your extremities, particularly your feet.
Someone with diabetes can cut their foot and not realize it, and this can cause an untreated wound to develop into an infection, which can require amputation. Of about the 200,000 amputations done each year in the US, over half were performed on patients with diabetes, according to NIH.
Age, family medical history, and race all contribute to your risk of type 2 diabetes, and they're all things that you can't control. But fortunately, the 2 biggest risk factors, both diet and exercise, are things that you definitely can control.
It's important you know where you stand on your health. So talk to your provider, get a blood test so that you know what your blood sugar is at and if you're at risk for prediabetes. Even if you're not prediabetic, it's never too soon to make healthy changes. Get your weight to a healthy level and do 150 minutes of moderate physical activity each week. This is at a level where the intensity can allow you to carry on a labored conversation. Be sure to eat healthy, lower your calorie diet, and mostly eat fruits and vegetables, unprocessed meat, unprocessed grains, and no added high fructose corn syrup.
Your provider can recommend you more personalized specifics, but lowering your risk of diabetes starts with some preventative care action.